is the Agent Survival Guide podcast, Friday 5, our weekly recap of 5 things you should know about. I'm your host, Sarah Ruppel, officially welcoming you to the month of August. It's that weird time where it's still warm, so we're adding in some back-to-school shopping with our trips to the pool on the weekends. And for those of us on the Medicare side of the industry, certification season is in full swing for coverage year 2027. And certification is just around the corner for the ACA side of the industry. That being said, we do have some updates to report. Last week, we touched on the timelines for open enrollment. Now that we've got that sorted out and we're out of July, let's get into some important dates for ACA certifications. No word yet on an opening date for the FFM certification, but I would expect that to be coming soon. As far as the state exchanges supported here at Ritter Insurance Marketing, the FMO that powers this podcast, Georgia is the only training that has gone live at the time of recording this episode. We are expecting the Colorado training between September 1st and October 15th, and Connecticut should go live in October. Illinois has been a little more vague here, summer 2026, so that could be in August or September. And then Kentucky will open on August 16th, and Maryland will open on August 26th. As far as California, New Jersey, Pennsylvania, and Virginia, we are still waiting on when those certifications will go live. But we will keep you updated if anything changes between now and next week's episode. Don't forget that you can check on the status of those certifications within Ritter Docs if you're registered with Ritter Insurance Marketing. We will have the link to the certification center and the link to get registered in our episode notes. Continuing on with the ACA here, KFF recently analyzed rate filing data from ACA carriers and found that for coverage year 2027, they estimate a median premium increase of 15%. While that is down from last year's estimate of 18%, the actual finalized rate changes came in at a 20% increase for the ACA marketplace in coverage year 2026. And as a reminder, because I'm not a statistician and I tend to think in averages, median is where the most data points congregate when a data set is put in order. So there will be some outliers, but most insurers have plans with a 15% increase to their premiums. I can't say that we did not anticipate this increase coming given the disruption in the industry at the moment. KFF mentions quite a few factors. Expired tax credits, a drop in enrollment, which leads to an increase in risk pool mortality, higher costs, inflation, and labor shortages. Hopefully, we won't see further increases between now and the final rate changes, but we will be keeping an eye on these numbers. On Tuesday last week, CMS released their 2027 Medicare Part D bid information. This release marks the beginning of projections around the cost of Medicare for the upcoming plan year. The official name for this amount is the Medicare Part D National Average Monthly Bid Amount, or NAMBA. CMS calculates this amount by averaging together all Medicare Part D plan bids, focusing on basic Part D benefits, and then weighting the bids by number of enrollees in the plan. The bid amount, or NAMBA, is the subsidy the government pays Part D plan sponsors per member per month. CMS reported that the national average monthly bid amount of NAMBA for 2027 Part D prescription drug plans will be $296.05. Once again, we're seeing another sizable increase in this amount, pretty similar to last year when the NAMBA rose from just shy of $180 in 2025 to almost $240 for 2026. Back in 2024, and I'm adding this for context here, the Part D NAMBA was $64.28. And again, the NAMBA isn't what policyholders can expect to pay for their coverage in 2027. This is the average of what the government will be subsidizing to Part D plan sponsors offering prescription benefits. But also included in this same CMS report, we did get a ballpark figure on the cost of Medicare Part D. The national base beneficiary premium for Medicare Part D will be $41.33. Up from the national base of $38.99 in 2026. That's a 6% increase between coverage years 2026 and 2027, the maximum increase allowed thanks to provisions set forth by the Inflation Reduction Act that do not allow the Medicare Part D base beneficiary premium to increase more than 6% annually between 2024 and 2029. One other important change to note, CMS announced that they planned to end the Part D premium stabilization demonstration, an opt-in program for standalone PDPs. CMS created the demonstration to help plans ease into the changes introduced by the Inflation Reduction Act. CMS made the decision after determining that Part D sponsors seem to have adjusted to that legislation and they plan to, quote, return the program to operating under traditional market conditions in coverage year 2027, end quote. So Medicare Part D looks pretty similar to last year, which means we could be seeing another year of premium increases and potentially more non-commissionable Part D plans this AEP. We are currently awaiting official numbers on Medicare Part A and B, as well as the cost of living adjustment, or COLA, for 2027. But we did just get our annual Social Security and Medicare Trustees Fund report, which means we have some additional projections on the cost of Medicare in 2027. Again, by no means are these official numbers. They have changed between publication of the report and the official CMS announcement, so no guarantees, but they can help to give us some insight into what to expect for the upcoming enrollment season and how we should prepare. First up, Medicare Part B. The 2026 Medicare Trustees Report projects an annual Part B deductible of $292 in 2027. That's a little over 3% increase from the 2026 amount of $283 in 2026, $9 more in the projection for coverage year 2027. The Part B standard monthly premium projection was also included in the Medicare Trustees Report. In 2026, that amount is $202.90. The report projects an increase to $209.50, up almost $7, or a little over 3% of an increase. I will note that both the final Medicare Part B standard monthly premium and deductible were lower when the official numbers were released versus the projections last year. Hard to say if we'll see a repeat of that for coverage year 2027, but again, we will be keeping an eye out for the official release of those numbers. Last year, that info was released on November 14th. Hopefully, we'll get an official announcement prior to that this year. While we're on the subject of cost projections, we did just mention the Part B premium. That's usually deducted from most Medicare beneficiaries' Social Security checks automatically. So what does that look like for coverage year 2027? Each year, Social Security determines what their annual COLA will be based on data reported by the U.S. Bureau of Labor and Statistics in their Consumer Price Index, or CPI. With where we're at right now, using June's CPI report, the most up-to-date info we have right now, I've seen a range between 3.6 and 3.8% estimated for the 2027 COLA. Dollar-wise, that's an increase in the low to mid $70 range. So when you factor in the projected Part B premium increase, again, that estimate was $41.33. We are looking at recipients having a little over $30 more coming to their Social Security checks in 2027. Again, pretty similar to last year, but these are just projections and they are subject to change. We will be tracking all this information and other data that's important for agents in the lead up to the 2027 enrollment season. Check out the notes for links to the resources we mentioned in this episode. There's a lot of great resources to check out in there. Definitely want to bookmark the Certification Center. Keep checking back there, and you'll also find links to more episodes of our show. As always, we recommend following along with us wherever you get your podcasts so you don't miss out on any important information in the lead up to AEP and OEP 2027. Shoutouts for this week, and we'll start with Nancy for commenting on one of our episodes on Spotify. Thanks for listening, Nancy, and thanks for commenting. A shout out to Tessa here at Ritter Insurance Marketing. She is designing a project that we will be ready to announce in just a couple of weeks. Super excited about that, and if I don't get a chance to mention it outright before then, ask me about it at the summits. I will be attending all of them. Shout out to Jameson Keller and Debbie Hoffman for the interviews this week. We've got a lot of great content in post-production right now. Very excited to get into producing those episodes and getting those episodes out on the feed. And just in case you missed it, Monday's episode featuring Bobby and Danica is one that you really need to go back and listen to. We are having more and more conversations around cross-selling lately. This particular one includes the life and annuities products, so definitely take a listen to that. And if you did miss it, here's another reminder to follow along with our show. So when we publish those interviews, they are in your listening queue, just waiting for you to hit play. That's all we've got for this week. I hope you have a great weekend. Stay healthy and stay safe out there, and we will see you next week. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written and produced by me, Sarah Ruppel. Script proofing by Emma Hazard. Podcast designed by Urban Rivera. Follow along with our show to stay updated on industry news, online trends, interviews, and more.